Assalamu alaikum everyone. So we were going to talk in this content regarding the project number 3, arrhythmia detection through ECG. So I am Muhammad Awais bin Altaf. I will briefly describe uh, tasks which are in the project and explain how you can approach toward these tasks for the project implementation. So if you remember the lab 8, which we did on biomedical signal processing, and we talked something about the device miniaturization and wearable electronics. And we said something show you about the ECG signal, and we talked about some integrated circuits where we integrate on our sensor and try to operate at a very much low power so that we can achieve a miniaturized medical device. And the whole task of doing that process was that so that we can have some sort of patch sensor which is integrated on person chest explicitly for the ECG data. And in that process and that the sensor, we were integrating an analog front end for signal acquisition, followed by a digitizer, meaning a SAR ADC, so that we can digitize this data, and then we can process the data on a DSP, and we can then communicate that data for some further follow-up or for recording purposes. And also we said about some stimulation on chip. And the main thing, we were doing all these things on a very, very small area, which we call a patch sensor, and that's why we need integrated circuits. So that's the overall idea about the overall implementation, what we want to do. And today, this lab or this project is basically also aligned with the same thing. You are provided with an ECG data, which is acquired using the same mechanism, and you have to do some processing. What is that processing? I am going to explain that processing to you, and also I'm going to explain a little bit about the ECG signal, what are the main features and how you can look into it and what you can find out in this small project. Definitely, you are not going to work on the front end and the communication part or the ADC part, but mainly your focus is going to be again on the DSP part. So just a little bit revision again, just to as if somebody didn't have done that lab. So what we saw that we have something biopotential signal acquisition so that we can achieve maximum clinical impact. So for that, we have multiple leads connected to person chest, and each lead is giving some information about your heart polarization, depolarization, and that normally we call a 12-lead ECG system, and the patterns which comes as shown in this plot. So the data which is given to you is also the ECG data, but not a 10 or 12-lead ECG data, rather a 2-lead ECG data. Then this task, what we are going to do today, that you have an ECG data, something similar to which is shown here, and you are going to extract some features. What are those features? They will be R to R. I will explain what is R, what is P wave, what is QS, what is S wave, and what is the T wave. So I will elaborate all of these things in a moment. But these what you want to extract those features. And then based on those features, we want to classify something, whether the data is normal or abnormal. And we will define some terminologies for abnormal data and also the normal data. And just to achieve a complete system, we want to have some integration or recording. So in today's lab, in this project, basically you are mainly focusing on this feature extraction part again and the classification part. So I will directly move towards an ECG signal, which is commonly known as electrocardiogram signal. So ECG is basically tracing of your electrical activity that is taking place within the heart. So if this is an heart, so some electrical activity is happening. How it's happening under normal circumstances, our heart is divided into 4 chambers. The upper left and right are known as arteries, and the lower are known as ventricles. So we have basically 2 arteries and 2 ventricles. So these are the 4 chambers. Under normal circumstances, an electrical pulse will travel from all the 4 chambers of heart. This electrical impulse causes the 4 chambers of the heart to contract and relax, as shown in this animation, that's contraction and relaxation. And based on this contraction and relaxation in one whole cycle, we have one waveform being captured. And that one waveform, which is shown or depicted on the left, this side, and also in the form of a blue here, showing the contraction and relaxation. This is an ECG signal, or commonly known as electrocardiogram signal or heart signal. Okay, and studying these electrical impulses which are going through this heart, creating some waves, is very much important in understanding the functioning of heart. Okay, so that's one thing. It's very much important if you want to understand the functioning of heart, how our heart is performing. So this one, which is shown here on the in the form of a box chart, is basically a common ECG cycle. One ECG cycle, and one ECG cycle, as I mentioned, is basically describing the flow of a blood from your heart, meaning contraction and relaxation, pumping of blood through heart, which is shown here. So this one complete pattern is ECG signal. So one ECG signal is comprised of a P wave, then we normally call QRS complex, followed by a T wave. So P, QRS, T, and sometimes we have a U wave. So one ECG pattern is comprised of multiple waves known as P wave, QRS complex, T wave, and U wave. And based on the amplitude of P wave, based on the amplitude of a QRS complex, based on the amplitude of a T wave, S wave, Q wave, opening of these waves, meaning that interval of this PR interval, QS interval, QT interval, we detect, or the practitioners, the cardiologists detect the working of the heart, how the heart is behaving. So for example, if we talk about the P wave, which represents the depolarization of atrial, the depolarization of the atrial, meaning the upper chamber, both right and left. So the P wave represents the depolarization of both of the left and the left arteries, and it is a relatively positive amplitude, which can be seen here. It is not the most or not the maxima in the overall system, but it is somehow a positive amplitude which arrives in your ECG pattern before the occurring of QRS complex. And the QRS complex, as it suggests the name, it's combination of Q, R, and S wave. R wave is the highest peak in your ECG pattern. Okay, and this is the peak which shows that how much your beats per minute, if you find the difference between R to R peak, something similar which you have done in the lab 8. And also these three waves, Q, R, S, shows the ventricle depolarization, meaning on the lower heart chamber, the depolarization is shown by this QRS complex. And again, the magnitude or the opening of this QR or the magnitude of R peak depicts the working of your heart, whether they are less, whether they are more. It shows how your heart is operating. I will a little bit elaborate how these leads to abnormalities in a coming slide. And then this QRS complex is followed by a T wave. And T wave is what? Ventricle repolarization. When it's going to repolarize again in the ventricle, the lower chamber. So then we have a T wave. So T wave also occurs, and sometimes there's a U wave also, which is followed by a T wave and the next T wave. One important thing which we need to know is all of these waves are not present all the time. Sometimes we have missing P wave, missing T wave, missing Q wave in an ECG pattern. So there can be some variations, but these all variations depict some abnormality, which we also mentioned in the previous lab session, that okay, these all abnormalities or these all ECG patterns relate to some abnormalities, and we cannot have information of all of them. That's why we need some support system who can support the cardiologist and who can support how we can deduce or we can extract the information from all the things. So the normal, this ECG trace, one ECG trace is conduction of electrical impulse from the arteria to ventricles, from coming blood from here, arteria to ventricle, going from the down part of the heart. So this is basically showing the activation of the arteria, activation of the ventricle, the blood coming here, pumping in, pumping out. So that's pumping in, pumping out, showing this expression. Right. So what about the cardiac arrhythmias? The cardiac arrhythmia is basically the abnormal pattern. Arrhythmia means abnormality. So we have abnormality in the heart. So normal or the regular rhythms when heart is operating in a normal heartbeat, meaning the R to R distance, the difference between the R peaks to R peak in a 1 minute is between 60 to 100 beats per minute. So if we have this rate, this means our heart rate is pretty much normal. The person is healthy and young. This is the normal rest state heart rate. So it's beats per minute. If we have a fast heartbeat, if something is greater than 100 BPM in normal state, not in running state, in a normal state, if heart rate is constantly greater than 100 BPM, this means that you are a tachycardia patient. Your heart rate is higher than normal, so you need to visit the doctor so that they can work on you. Also, if we have heart rate lower than 50 BPMs, which is shown here, this means your heart rate is slower than normal, normally called tachycardia, that your heart is operating slower. Again, you need to visit a doctor. And explicitly, both of these conditions are not that much severe as compared to the irregular heartbeat. If your heartbeat is not consistent, meaning in 1 minute or in couple of minutes, your heart rate varies a lot. It varies from 60, 70, 80, 60, 70, 80, 80, 70, 60. Even it's lying in the normal window. But if there is a variation being reported, this means there is something wrong. There's something wrong which is going to be depicted in the ECG pattern, which you can see here, and also something which you need to see in today's lab set, in today's project, in this project, that you have to figure it out. And this basically irregular heartbeat is known as cardiac arrhythmias, and we need to focus on this part. So for the cardiac arrhythmias can be figure it out by multiple ways. It's not only the one condition. Your QRS complex, which you just shown, can be wider than normal, or the T wave and the QRS deflect in opposite direction. T wave is going up positive, QRS complex is negative, or vice versa. So this can be also one of the reasons. P wave is absent. P wave is absent can be pretty much common scenarios in a lot of scenes. And also the main thing is that we can detect these and most of these arrhythmias with the help of R wave, S wave, T wave, Q wave, and P wave. So if we can detect these waves, their amplitude and their index, where they are lying on the pattern, because if we know the index, we can know the distance between these specific waveforms. So we can detect those things. So there are different types of arrhythmias: premature ventricle contraction. This is the PVC, which is the most common and least severe one, commonly known as PVC. Then we have ventricle tachycardia, VT. Then we have ventricle fibrillation, ventricle flutter, hydroventricular rhythms, and diastole. So ventricle fibrillation and ventricle flutter are pretty much serious. They lead to death basically. Ventricle tachycardia is again a severe condition which needs proper monitoring, and PVC is something which is a normal scenario. So today in this project, we will mainly focus on PVC detection and ventricle tachycardia detection, but most of the time we are going to spend upon ECG pattern and how we are going to detect these features which I mentioned up and which were shown in the initial plot. So moving forward, a little bit about the PVC, commonly a premature beat. Again, it's a premature signal, not mature, that you should be raising an eyebrow, or you have to visit the doctor. If it is coming, it's fine. You need to be careful. You just need to monitor it. So electrical irritability in the ventricle conduction system or a muscle tissue. So you have some issue in the muscle tissue, even called this PVC. That's why it's not that much dangerous. So it can be detected by two of these conditions. If two of these conditions occur at the same time, this means this is a PVC. Short RR interval, that RR interval is shorter than normal, meaning less than 0.5 second, 0.6 second. If your RR interval is less than 0.6 second, or one of these two conditions occur, this means you are a PVC. What are the other conditions? Log ST interval. So ST interval is longer than the normal one, meaning more than 0.28 second, or the higher T wave amplitude. The T wave amplitude is higher than 100. At this moment, I'm placing some numeric values because this is represent the ADC code. In reality, this should be patient adaptive, but I am placing it a fixed value of 100 for the data which is provided to you. So if your T wave amplitude is greater than 100 in a normalized environment, and your RR interval is less than 0.6 second, or your ST interval is greater than 0.28 second. If two or all three of them occur in the same pattern, this means the data is going to be considered as PVC, and that you need to detect. So you can see the real PVC pattern, how it looks like. So this is, for example, a PVC pattern which is shown here. So this is, for example, a PVC pattern. So this is MATLAB plot is the data which is provided to you. So you need to find this pattern, which is basically the distance between the ST interval, the RR interval, and the T wave amplitude. So all of these things you need to figure it out in this project. So the second abnormality or arrhythmia which you are going to focus is ventricular tachycardia. So it's extremely unstable rhythm, which is the most common cause of sudden death. It is something which need to be which need to make your eyebrows raise, but still not that much dangerous, but you have to be careful. So 3 or more PVCs occur in a row, meaning if you have 3 or more PVCs occur, this means a VT. But if you have this such condition, this is very much dangerous. But 3 or more PVCs occurring, this means it's a ventricular tachycardia, and you need to visit doctor. You need to see a cardiologist. And consistent VT will lead to definitely sudden cardiac death, or we need ventricular fibrillation. So that's what we're also going to do in this project. But starting with the features which you are going to focus on, you will mainly focus on multiple features. Those features are basically R wave amplitude index and indices, S wave amplitude and indices, T wave amplitude and indices, and also you are going to find the Q wave amplitude and indices and P wave amplitude and indices. These you are going to figure it out, but you are not going to use for the classification, but you are going to deduce or calculate from your ECG pattern. And then you are going to also do the heart rate variation, meaning, as I mentioned, that R to R variation is very much important. Not only the average value, rather how per beat it's varying. So that's also you need to measure that how your this variation is happening across each specific beats. So commonly known as heart rate variation or heart rate variability, HRP. That's pretty much common terminology we use. Then the PVC variation, meaning for the PVC we just saw we need 3 main signals: RR variation, ST interval, and the T wave amplitude. So we can figure it out these from these features which we just mentioned up. So you can find out whether the signal is PVC or not PVC. Moving forward, let me erase them. Yeah, so how your basically heart rate variability will look like. Somehow you will have the pattern which will be shown. So your pattern will be somehow shown in this configuration, where you are going to have your ECG data, which is shown in the red line here. Time axis is seconds, and this blue line is showing your heart rate variability. You can see that there is some variation which is being recorded in the heart rate. It's not consistent across one line, 60 to 70. Rather, there's a heart rate variation which is reported around more than 20 to 30 beats per minute, and that's something which is alarming also. So this heart rate variation is not that much good. So as I mentioned, you are also going to work on multiple features apart from those RST. You are also going to see the Q wave and the P wave. So Q wave and the P wave detection, meaning you need to work on the amplitude and the indices of these waves. So main thing, what is the workflow for your overall system? So this slide shows the overall state flow diagram, the way which you can implement the detection of all these waves. So you are provided with an ECG data, which is digitized and sampled at 360 samples per second. So commonly you can use a state flow implementation. In a state flow implementation, what you can find, so first of all, you need to find out the maxima. You have an ECG data which is coming, so you need to find a maxima of that wave. So we mentioned that the maximum point after pre-processing, meaning after getting rid of the offset value and getting rid of the noises, the maximum value is going to be R peak. Okay, the R wave. So you can find the R peak amplitude, and you can find the index, corresponding index, the location where it is lying based on this maximum point. So you will find the local maxima, and that local maxima will give you the R wave amplitude. So in this window, if I'm going to find the R wave, I can find the R wave amplitude and I can find the R wave index. So after that, once I find this R wave, the important thing is that I need to find what is the next thing. The next thing is Q wave. And what is the Q wave? The Q wave is basically the dip or the minima which comes before the R wave. So I find R wave, now I need to find this point. So for this point, I will go from one state to another because I can only detect the Q wave once I have detected the R wave. I first find the peak R wave, and then I'm going to find the point of Q wave. So first, in a state one, I find R wave. Once I find R wave, then I'm going to go to find Q wave. And that's what the concept of the state flow diagram. You go from one state to another. You cannot go to the Q wave detection until you find an R wave. So that's why we are going in a state 0. From the state 0, it will tell us I find R wave. Now I want to proceed towards the Q wave detection. So for Q wave detection, what we will do? So we were going to go back and we are going to, subtract some distance. What is that distance? So normally Q wave occurs within a window of 0.05 second before R wave. So in this 0.05 second window, if I draw this window here, in this window, for example, before occurrence of R wave, the Q wave can come. So I can look for a local minima. So if I can find a local minima here, that local minima will be Q wave. So I can find its amplitude again from the baseline and also its index. So I can find its amplitude and index of the Q wave. Once again, I find Q wave, I will again go to another state to find P wave. So how I'm going to find P wave? The P wave occurs in a window of 0.1 second before the Q wave occurs. So again, what I will do, I will just have another state and will search before 0.1 second in this window, the local maxima. And that local maxima will give me the point of P wave, which is shown here. So once I am able to find this point, the local maxima will tell me the information about the P wave amplitude and the P wave index. Once I find this thing, I will go back to the detection of S wave, which is local minima in a window of 0.05 second after R wave. So this is the R wave amplitude which was detected. So in a window of 0.05 second after R wave, my S wave will come. This is again a local minima. So I can find a local minima. Once I detect this S wave, then I'm going to find the T wave. So T wave is what? T wave is going to be like after occurrence of S wave in a certain window, I will find for a local maxima, and that local maxima will be linked to my T wave, and that's somehow equivalent to 0.4 second or 150 samples. So in a 150 samples window, I can find my T wave. And once I am detecting my T wave, I have find out R wave, T wave, P wave, S wave, and Q wave, their amplitude and their indices. And that's the feature which we need for our implementation. And once we have find out, we will wait for some time so that no other peak comes or we get the new peak, the PQRS pattern or the new beat. So we are going to wait for 0.5 seconds. So once 0.5 seconds is passed, we are going to go to the state 0, meaning waiting for the next PQRS complex, because they are going to come after every pattern. So we'll wait for these things and we'll continue this pattern. In this way, we can detect all these PQRS patterns from an ECG wave. So if we move forward towards the specific task, so the first task is data plotting and analysis. You are provided with the two ECG cases, case 1 and case 2. You can download from LMS and in your specific MATLAB directory. The MAT file has the information about the ECG data and the sampling frequency. So you can first thing, you can just plot them in a map, in a plot from in a MATLAB. both of them, and you can see how the signals are and how they can look into it, and you can identify manually. You don't have to do a code, but after plotting, you can manually identify the arrhythmia type. Is it PVC? Is it VT or any arrhythmia or no, just by naked eye. And you don't have to much worry. And also you can see this PQRST patterns, which you just identify in the ECG case one, you can identify easily. So first three parts are mainly just finding those plots. On this plot, you can just mark them so that it's easy for your understanding. So in the next phase, you can just point out. So for example, the output of the first part will be something similar to this one. You have this ECG pattern, and then you can zoom in to show this PQRS. For example, this is going to be R, this is going to be P, this is going to be, let's see, right, this is P, R, this is going to be Q, this is going to be S, and this is going to be T. So you just need to identify all at this moment manually. And the second phase, you have to write a state flow code so that you can identify them. In the task 2, you need to do the heart rate and heart rate variability. For heart rate variability, you need to get rid of the noise, and also you need to get rid of the offset value. So once you get rid of the noise and offset, your ECG pattern, and you need to draw the heart rate variability, something which we just shown in the previous one. So how heart rate is varying per beat. So you can just find the distance divided by multiplied by 60. That will be heart rate variability. So means distance of each peak. Okay, this distance comes in second. You can multiply it by 60. That will be beats per minute. Something similar you have done in the lab 8. Then comes the feature extraction. In the feature extraction, you have basically, you only have to initially apply for the case 1, meaning the ECG data 1. So for that, you have to find out all the 5 features: amplitude and index of R wave, amplitude and index of Q, P, S, and T. You need to write a MATLAB code which can identify all those plots and also mark on the plot. For example, this is a ECG pattern, ECG case 1. And all those 5 signals, R wave, S wave, Q wave, P wave, and T wave, are marked on that ECG pattern. So that's you need to do in this task 3. So that's you have to be mainly, it's going to take much your effort, that where you are going to find your logic and how you are going to detect all of these patterns. Once you are done with that, you are going to move toward task 4, which is basically the feature extraction, but applying on the ECG case 2. This data is a little bit more towards an abnormal. So it has, the data is clumsy. So you will apply the same thing which you have done in the previous task 3, the feature extraction part, but you are only going to work on 3 features: R wave, S wave, and T wave, because some things are missing. So I would like, you can ignore the Q wave and the P wave in the task 4. You can only focus and improve that if you have some issue in the R wave, S wave, and T wave amplitude and index detection, and you can figure it out. You should be able to detect all those patterns correctly from the second case. Once you are done with that thing, then you have to do the classification. For the classification, what you need to do, you need to do 2 types of classification, meaning that whether there is an arrhythmia in your pattern. If there is no arrhythmia in your pattern, it should display a signal, okay, no arrhythmia detected. If there is an arrhythmia, so you need to mention what type of arrhythmia. For example, if it's a PVC, premature ventricular contraction, you say a PVC detected at what time patterns, or if it's a VT, VT detected at what time pattern. You can just write the time pattern of the starting one, and you can just mention that thing. So these are basically the 5 tasks which you need to do for the completion of this project. The timelines are already mentioned in your project guideline. If you have any concern, query, you can also email me. You can contact your TA, and I can set up some office hours if you have some further queries related to the specific implementation. But main thing which the task for me is going to take your time, first thing is understanding the ECG pattern, and after the understanding of ECG pattern, the state flow implementation. Because that is, if you understand that point, then the rest things are piece of cake for you. So again, if you have any confusion, you have any concern, you can send me an email, or we can set up some office hours for follow-up discussions. Thank you and best of luck for your project.